If you want your body and your brain to work at their best, you have to give them the essential nutrients they depend on. And one nutrient that quietly affects many systems at once is vitamin B12. B12 supports your nervous system, your energy production, and your blood. And here's something a lot of people don't realize. When B12 is low, you may not just feel a little off. You can feel foggy. You can feel unusually tired. You can even notice changes in your balance, mood, and memory. Some people also notice changes in weight and appetite patterns, because when your energy systems are not running efficiently, your habits and metabolism can drift in ways you don't expect. In this video, I'll explain what B12 does, how to recognize the common signs that your levels may be too low, and practical ways to correct a B12 gap in a safe, sensible way. And just so we're clear, this is educational. It's not a personal diagnosis. But by the end, you'll know what to watch for, what questions to ask, and what steps often help. If you're over 50, this matters even more. Because as we age, absorption of certain nutrients can change, and B12 is one of the biggest examples of that. Now, if you want more calm, useful health guidance like this, subscribe and turn on notifications. And let me ask you one quick question. Have you ever had your B12 checked, even once? Type 1 if you have. Type 0 if you haven't. I read the comments and it helps me shape future videos. Let's start with the first part, the most common signs of low B12. To be clear, the best way to know your B12 level is a blood test. But not everyone gets lab work regularly, and not everyone knows what to ask for. So learning the signs can help you recognize when you should consider getting checked. The more of these signs you recognize, the more important it is to take the possibility seriously. Sign number 1 is tingling, burning, or pins and needles in the fingers or toes. Many people notice this in the fingertips or the tips of the toes. It can feel like mild numbness, tingling, buzzing, or a burning sensation. The reason is simple. B12 plays a key role in nerve health. When B12 is low, nerves can become more sensitive or less stable, and that can show up as uncomfortable sensations in the hands and feet. Now, tingling can have other causes too, including blood sugar issues, thyroid issues, and even posture or nerve compression. But if tingling is new, persistent, or getting worse, it's worth thinking about B12 as one possible factor. Sign number 2 is brain fog or mental slowness. This is one of the most noticeable signs for many adults. You might feel like your thoughts are slower than usual. You may have trouble focusing. You might forget what you walked into the room for. Or you may notice that your memory feels less sharp than it used to be, especially short-term memory. B12 supports nerve function, and it also supports processes in the brain related to memory and clarity. When B12 is low, some people describe it as feeling mentally cloudy, as if their brain has less energy to work with. And here's the encouraging part. When low B12 is a key contributor, improving B12 status can help many people feel clearer again over time. Sign number 3 is chronic fatigue that doesn't match your lifestyle. Everyone gets tired sometimes, but B12-related fatigue can feel different. It can feel like you're running on a low battery even after rest. B vitamins, including B12, are closely tied to energy metabolism. They help your body convert food into usable energy. When B12 is low, that system may not run efficiently. You can feel like you're dragging through the day, even if you're sleeping. Again, fatigue can have many causes, but if you have fatigue plus other signs on this list, B12 becomes a more likely piece of the puzzle. Sign number 4 is changes in the tongue. This one surprises people. Normally, the tongue has a textured surface with tiny bumps called papillae. When B12 is low, some people notice that the tongue looks smoother than usual. Others notice swelling, tenderness, a burning sensation, or changes in taste. If your tongue feels sore, looks unusually smooth, or seems different than it used to, it's worth paying attention. Sign number 5 is mood changes, including low mood. This is an important topic, and I want to speak about it carefully. Mood can be influenced by many things: life stress, sleep, isolation, inflammation, gut health, and nutrient status can all play a role. B12 is one of the nutrients that can influence the nervous system and brain chemistry. When it's low, some people report feeling lower, flatter, or more emotionally drained. Now, I'm not saying B12 is the only answer to mood problems, but I am saying it's wise to check physical contributors before you assume it's purely emotional, especially if mood changes appear alongside fatigue, brain fog, or numbness. Sign number 6 is balance issues. Balance is complex. It involves the inner ear, vision, nerves, muscles, and brain processing. When B12 is low, nerve signaling can be less stable, and some people notice that their balance feels slightly worse. Not necessarily falling, but more unsteady, more cautious on stairs, less confident on uneven surfaces. If balance changes are new or progressive, they deserve medical evaluation, and B12 is one possible factor to rule out. Sign number 7 is ringing in the ears, sometimes called tinnitus. This can have many causes too. Hearing changes, blood pressure, stress, jaw tension, and medication effects can all contribute. But some people report tinnitus alongside nerve-related symptoms when B12 is low. It's not a guaranteed sign, but it's a signal to consider in context. Sign number 8 is signs related to anemia. Low B12 can contribute to a specific pattern of anemia, and anemia can make people feel pale, short of breath during activity, tired in a different way than normal fatigue, and sometimes aware of heart pounding or faster heartbeat. This happens because B12 is needed for healthy red blood cell production. Red blood cells are replaced constantly, and when B12 is low, the body can struggle to produce them correctly. Now, those are the signs. But the question most people really care about is this: what do you do if you suspect low B12? Let's go step by step. First, you correct it through food when possible. B12 is naturally found primarily in animal foods. That's why people who eat some animal foods tend to have a lower risk of deficiency than people who avoid them completely. Among animal foods, the richest natural source is liver. Many people don't enjoy it, but it is very dense in B12. Other good sources include fish, meat, poultry, eggs, and dairy, though amounts vary. If you eat those foods regularly, you may think, then why would my B12 be low? And I'll answer that in a few minutes because intake is only part of the story. Absorption matters too. Now, what about people who eat a mostly plant-based diet? Strict vegan diets have a higher risk of B12 deficiency unless B12 is supplemented or regularly consumed through fortified foods. Some foods, like nutritional yeast, are often fortified with B12. That can be helpful, but you need to check the label to confirm it is fortified. You may also hear about algae like spirulina, nori, or chlorella. Some contain B12-like compounds, but not all forms are well used by the body. If someone depends on plant sources alone, it becomes more important to use fortified foods or supplements because relying on uncertain sources can be risky. Now, there's another factor that's often overlooked. Your gut microbiome can play a role in producing certain nutrients. A healthy gut environment can support nutrient metabolism. And feeding your gut bacteria with fiber-rich foods supports overall health. Some people also use soluble fiber supplements like inulin, which can help support beneficial bacteria and improve blood sugar regulation in some individuals. But I want to be careful here. You should not rely on the gut microbiome alone to supply your B12 needs, especially as you get older. It's not a dependable strategy for most people. So for many adults, especially over 50, the second method matters a lot. That is supplementation. If levels are significantly low, supplements often raise B12 levels faster and more predictably than food alone. Many supplements come in doses that look surprisingly high, sometimes hundreds or even thousands of micrograms. That's because absorption is limited and varies by person. Higher doses can compensate for lower absorption. People often ask, how much should I take? As a general concept, mild insufficiency may be addressed with lower doses, while more significant deficiency is often corrected with higher doses under professional guidance. Many people use a higher dose for a period of time to restore levels, then switch to a maintenance dose. The right approach depends on your lab values, your symptoms, and why your B12 is low in the first place. Now let's talk about forms of B12, because not all forms are identical. One common form is cyanocobalamin. It's synthetic, stable, and widely used. The body can convert it into active forms, but that conversion requires steps, and some people prefer other forms. Another form is methylcobalamin. It is closer to one of the active forms used in the body, and many people tolerate it well. Some people choose it because it may require fewer conversion steps. In real life, both forms can work. What matters most is that you correct a deficiency and maintain healthy levels consistently. Now we get to an important question. What if you eat B12-rich foods and still have low levels? This is where many people get confused, and it's one of the most important parts of the entire topic. For your body to benefit from any nutrient, 4 things have to happen. First, you have to consume enough of it. Second, the food or supplement has to actually contain what it claims to contain. Third, you have to absorb it properly. And fourth, your body has to be able to use it effectively. If any one of those steps fails, you can still end up low. With B12, absorption is a very common problem, especially as we age. To absorb B12 well, your stomach typically needs adequate stomach acid, and your body needs a substance called intrinsic factor. Intrinsic factor helps carry B12 through the digestive process so it can be absorbed. Here are some situations that can reduce B12 absorption. One is a history of stomach surgery. Another is certain intestinal conditions that affect absorption, including inflammatory bowel issues or celiac disease. Another is low stomach acid. This becomes more common with age, and it can also be affected by long-term use of acid-reducing medications. Some people take antacids or acid reducers for reflux. These medications can be useful when needed, but long-term use may reduce the absorption of certain nutrients, including B12. That doesn't mean everyone should stop medications. It means if you take acid reducers regularly, it's smart to be aware of B12 and discuss monitoring with a professional. There is also a common medication used for blood sugar management that has been associated with reduced B12 levels in some people. If you take blood sugar medication long-term, it's wise to ask your healthcare professional whether periodic B12 monitoring makes sense for you. Now, let's talk about the lab side in a practical way. If you're testing B12, a basic serum B12 test is a start. But sometimes people have symptoms even when the number looks in range. That's why some clinicians also look at related markers, such as methylmalonic acid and homocysteine, which can help clarify whether B12 function in the body is truly adequate. And here's an important concept. There's a difference between normal range and optimal for you. A lab range can show what is statistically common in a population, but optimal levels for brain clarity, nerve comfort, and healthy aging can sometimes be different depending on the person. Genetics can play a role too. especially in how the body handles methylation processes that interact with B12 status. That's why a personalized, risk-based approach is smarter than guessing. Now, I want to wrap this up with a clear, calm takeaway. Vitamin B12 is essential for nerve function, memory support, energy metabolism, and healthy blood. Low levels can show up as tingling, fatigue, brain fog, tongue changes, mood shifts, balance concerns, and anemia-related symptoms. The good news is that B12 deficiency is often correctable, and when you catch it early, you reduce the risk of long-term problems. So here's what I recommend. If you recognize several symptoms from today, especially if they are persistent, it's wise to ask your healthcare professional about B12 testing. If you're over 50, if you eat very little animal food, if you've had stomach issues or surgery, or if you use acid-reducing medication long-term, it's even more important to consider checking. And if you found this helpful, do two things. First, share this video with someone you care about, especially an older family member who complains of fatigue, numbness, or brain fog. Many people live with these symptoms for years without realizing there may be a fixable nutrient gap. Second, write in the comments, which symptoms surprised you most? Tingling, brain fog, tongue changes, balance, fatigue. And if you want more calm, practical health guidance for adults 50 and over, subscribe, hit like, and I'll see you in the next video.